Hello, and welcome everyone to our panel on redefining chronic disease care. My name is Alex Knapp. I am a senior editor for Healthcare and Science at Forbes magazine. I'm really delighted to have the opportunity to have this panel that I think is going to be really forward-looking, looking not only what telemedicine is doing today, but its prospects and potential for the future. And I want to kick things right off with Sally Wellborn, who is a former senior vice president of global benefits for Walmart stores. And Sally, in the last few months, we've seen a real acceleration of telehealth and telemedicine, and especially due to the pandemic, but I also think because the technology was really ripe for the plucking. And I'd love to take a big picture view of this at first and tell me, for employers, what are you seeing as the benefit for telemedicine in handling workers and especially dealing with a crisis like the one we're dealing with now?
Yeah, thanks, Alex. So I think, as you mentioned, employers began embracing telemedicine 15 years ago with some of the early contracts with Teladoc and some of the early innovators in this space. And so there has been a recognition, an intellectual recognition that delivering healthcare differently is an appropriate way to deliver healthcare. And in general, employers have been pushing for changing the way we deliver healthcare. So now fast forward, so let me fast forward to that 6 months ago, where many of us as employers had telemedicine solutions. And by the way, we were also implementing a lot of what are commonly referred to as point solutions, many of which have remote elements to them or digital elements to them. So that was the beginning, but no one was really satisfied with the usage of telemedicine. As we know, it was very low. There was still this concern of, is it just forcing inappropriate utilization or is it really supporting remote utilization? Now we know that once the pressure from not being able to go in person, we know what the result is. And I think that employers are thrilled that now we get the opportunity to redesign how healthcare is delivered through the point solutions, the telemedicine solutions, et cetera, that we've been implementing. And now the question will be, how do we bring it all together to really influence the delivery of healthcare so that it's more efficient, it reflects an appropriate care, and it's higher quality. So I think at the highest level, employers in general are super excited about this, but super worried about how things might revert back to the mean, as a friendly actuary might say, going back to the way things used to be if other elements of the system don't change.
So I want to get into some of those other elements, because one of the big things impacted by the pandemic is that people who have chronic conditions are often also at higher risk for severe cases of COVID-19. And so Francine Kaufman, I'd like to introduce you at this point. Fran is the former president of the American Diabetes Association. She's currently the chief medical officer for Senseonics and also is practicing medicine and disappeared from our screen. So we'll get back to Fran when she comes back to join us. So let's talk to Connie Chen. She's a chief medical officer at Lyra Health. And Connie, I know you said something really interesting when we were kind of preparing for this panel about blended care and about how telemedicine has the potential to do more than just kind of repeat the doctor's office experience. So I'd love to get your thoughts on that and how it kind of ties into what Sally was saying.
Yeah, so like Sally, we've seen a huge transition to virtual care with the pandemic. And I think it's been a really exciting trend for a couple of reasons. One being, I think video just enables access in a way that's challenging. You have to drive to an office-based visit. In the case of mental health, you might be doing 10, 15, 20 sessions within a couple of months of care. The other reason is that with technology, there's really an opportunity to not just translate what happens in the office to a virtual setting, but to really transform the model as well. You know, when we look at mental health care, I think traditionally there's just too much of an emphasis on the visit or the session itself, when the reality is that clients live their anxieties day to day between sessions with their therapists. So with Lyra, we've transformed the care model to combine session-based video-based session treatment with a heavy emphasis on asynchronous in-between session care that's really enabled by technology. So this is a combination of secure messaging to check in with clients to make sure they're implementing the skills that they've learned in session. It's engaging in kind of digital psychoeducation, skill building. You know, a lot of mental health treatment is about completing things like thought records and other things where you're really trying to change your behaviors, emotions, and thoughts between your session. And that has proved incredibly effective. We see that clients get better with fewer sessions of treatment, they get better at higher rates. And this is something that'd be really hard to do if you were driving back and forth to sessions with your therapist and really not engaging in all that time in between.
Yeah, I think it's really fascinating. And when you say that you found it more effective, how are you able to kind of validate that? Like, how can you tell that patients are doing better, and you know, how are you able to take those results and then, you know, even refine that care further?
It's a great question. So we are really passionate about data at Lyra. So because clients are so engaged in our digital platform, virtually 100% of them complete outcomes tracking between every session. So we practice measurement-based care. And according to our data, 87% of clients who start care demonstrate reliable clinical improvement or recovery, which is really extraordinary, even compared to gold standard CBT. And that happens in as little as 6 sessions. You know, usually CBT would be about 16 to 20. And as we've done advanced statistical modeling, we are actually able to show that in-between session engagement, those lessons and exercises, are driving actually a meaningful part of the therapeutic recovery if you're measuring the points in the PHQ and GAD that are getting better. And it's a lot more efficient from a time basis than the minutes you spend in session. So it's really fascinating as we tear apart the science of what's going on and really driving improvement.
That I think it's really fascinating, and really I think highlights some of the benefits of some digital tools for mental health. Fran, I see that. Welcome back. I'm glad that you're here and able to join us. So we were just talking with Connie about how taking mental health tools in addition to the video visits, that combination helps to improve care. And I know that in your line of work, you're dealing with people managing chronic physical conditions, and I'm curious to see if that combination of digital tools and sensing and the video visits is also seeing results with your patients. You're on mute right now, though, Fran.
Hold on, I'm sorry.
There we go.
I want to apologize. My internet went out right as this was starting, so that is obviously one of the issues that one faces with telemedicine. But I want to be sure that I'm an endocrinologist, so most of the care we're giving is to people with chronic illnesses such as diabetes, that telemedicine isn't viewed as just another way to deliver the same kind of health care that we've been delivering all along, that it is something that can be augmented with a number of digital tools, a lot of back and forth data, so we can get data from our patients, particularly from something like a continuous glucose monitor, that can enable us to change therapy along with how are they sleeping, a lot of other inputs, and then offer digital therapeutic programs, ones that they can join for 6 weeks or 12 weeks or longer, that deal with nutrition, lifestyle, and that is a combination. And then using AI, using other healthcare providers can really make a difference. Lot more touch points, lot more opportunity to really reach the patient where they need to be reached with their daily decisions that impact on their diabetes care. So we need a full transformation and not a substitution of telehealth for an inpatient visit.
Yeah, Alex, if you don't mind, I'll just jump on what Fran was saying. So if I think about employers and the way employers influence things, there were clearly some innovators who came up, particularly like in the diabetes space with Livongo and Onduo and things like, companies like that, and Virta, that created this opportunity to change the way that healthcare is delivered through remote monitoring, through remote coaches, people who are not necessarily clinicians, but are trained to be able to support employees. And it's happening all day long in the mental health space, Connie, right? With coaches that can help because it's exactly what Connie was saying. Our members are suffering with conditions all day long, every day. They're not just suffering with the condition the few moments that they happen to be in a doctor's office. And so these remote monitoring tools that are augmented with clinical intelligence through AI or machine learning or whatever is really what employers have been embracing to push this further, faster, because to be perfectly blunt and to be a little provocative, it hasn't been coming from the healthcare delivery, the traditional healthcare delivery system. It's being pushed by these innovators who are being driven by purchasers, employers, and to some extent Medicare.
So Sally, I'm curious because you mentioned that employers have been looking at telemedicine tools for a long time, and before I ask you a quick question about that, I also want to let you and the audience know that we are taking questions. We're open to questions. If anything here piques your interest, let us know. We want to engage you in this conversation as well. And while we wait for those questions, Sally, over the past, I think, year or two, there's really been an explosion of the number of companies that have telemedicine tools, that have these digital therapeutic tools. I know for me as a journalist, I probably get an email every week letting me know about a new one. How do employers kind of find the best companies to work with? And Sally, while you answered that, Connie and Fran, I'd love for you to think about how you, as those companies, then kind of engage with employers and other healthcare providers to get your services out there.
Well, Alex, if you're only getting one email a week, you aren't on the right list, because it should be one email an hour. But so the truth of the matter is, it's extraordinarily difficult for employers, at large, to sort through all the things coming in their inbox, to be perfectly honest. There are a number of organizations that support that, groups like the Employer Health Innovation Roundtable, EHIR, National Business Group on Health, some of the other local business groups on health will bring some of these solutions together. The truth of the matter is, it's a classic curve where you have a few of the employers that will be the first to implement, and then we'll learn from each other, and then we'll continue to move from that. I'll tell you that right now, today, in what I'll call the classic telemedicine space, which is the Teledocs, MD Lives, Doctor on Demands, or whatever, there is now this proliferation of competitors, and we're to a point now in this space where, a few years ago, we would have just had 2 or 3 to select from. Now we have more than half a dozen or 10, and now we're moving into RFP world. So it's moved from just getting that one opportunity to knock on the door and have a conversation to it's a real competition.
I do want to say that, at least in the chronic disease space, the patient as well has to really have an impact on what tools they're going to want to use. So from a continuous glucose monitor that is able to send the information to the healthcare provider, we're still, I think, in some of the infancy of how to aggregate that better and to get it into the, particularly the EHR, so that there's more records to get some, better reporting out to employers and payers. But I do think it's important, obviously, what people will allow, but the patient has to be in the driver's seat as well. And a lot of these have to really meet the unmet needs that they have in managing, from my standpoint, their chronic disease.
Go ahead, Connie.
I think for us at Lyra, and I think this is inclusive of both mental health and chronic physical disease, which is you're talking about somebody's health. So it's not something that employers are really willing and it's not something they should be totally experimental with. So I think for us at Lyra, two things that we've really leaned into. One is just a track record of demonstrated quality and a tremendous amount of data to support the clinical outcomes that we drive. We've been in the market for 5-6 years. We just delivered our millionth session, and I think just really being able to showcase really and prove out the clinical improvements really important. And I think the second thing is, with the proliferation of so many point solutions, no employer wants to be managing 20 vendors at once for every body part, right? So for us, we've built a very comprehensive set of mental health services, and it's actually interesting to talk about because we're at a Beyond Telemedicine panel. But I'd actually say something, maybe it's a little provocative. I don't think 100% of mental health care should be virtual. We've found that the transition with COVID has been very positive, and we really hope that it remains majority virtual, but something like 75% telemedicine and 25% in person probably feels like the right natural state, just because there are a lot of mental health conditions like self-harm or active suicidality that shouldn't be treated virtually. And then there's just clients who are not going to come to care because they need that accountability of an in-person visit.
That makes sense.
Go ahead. Connie, I think you're hitting on an important thing. Both there are necessary points where things should be in person, but I think where we're getting to, it should be delivered how the person wants to receive it, right? And so I think that is the beauty of, or the elegance of telemedicine in the future, is that it can be whatever the person wants, because there are some people who would really, whether it's diabetes or mental health or heart, right? They may want in person, and some people would rather have virtual.
Yeah, I agree with that, although I do miss being able to actually examine my patients, and I agree with Connie. I do think there has to be a blend. This is not a total substitution. It's an augmentation, and I think a reorientation of how we view care. And it's not for somebody with diabetes now 4 times a year or 6 times a year. It should be available through, the visits, as well as the digital therapeutics and all the other support. If they need something every day, that's what they get for a while. If they need something every week or every quarter, we really have to, again, meet the individual needs. And the other thing I really agree with Connie is we need some evidence on, how these programs are really doing as far as hard metrics are concerned. And in diabetes, it's pretty easy to look at what those metrics should be. But those are going to continue to be really important.
Great. I agree, and I think these are terrific points. We do have a question from the audience that I think I'd love to start with Sally to answer this, but feel free, everyone, to jump in with your own thoughts. And the question is, why did disease management programs in the 90s fail while programs now are succeeding? And the question is it because of the technology improvements, or is it because of the roles that employers and other payers are playing within the ecosystem?
My opinion is that the reason that the solutions are succeeding now is that they are focused on the patient and the engagement, whereas what we did in the 90s was, here are the rules, here's what you were supposed to do, go do it. Right? Go to your doctor, go to get your test, do your exercise, do whatever. It was like telling you what to do. And now these solutions are more developed intentionally with things like plastic behavioral modification, right? Things that will gamify what you need to do, things that will engage you through, people that engage through monitoring, right? Just being able to see things on their phone. So I think it's as much about it's not the technology or the digitalization of it as it is the refocus from telling me what to do to engaging me to do what I should be doing. I don't know. I'd be curious to hear what Connie and Fran think about that, if you get the same point of view.
I'll add, I do think some of the programs are adapted from in-person programs. So we have good evidence now, particularly the diabetes prevention program for one. that could work in groups in the YMCA, and now it's been taken to a digital format. So for, at least in the diabetes space, a lot of these were what we were doing, and then just better understanding of the evidence for the in-person and the ability to then translate that into a digital format. And then obviously everybody's just more digital. I think it's certainly a complete aspect of our lives at this point.
One other thing I would add is, who wants to have their health plan or the insurance company call them? I mean, that, you know, that's just 101, right? So, and that's where all of that came from. And I think it's also just the voice that on the other end of the line.
Yeah, I would just echo what's been said. I think there's more technology enablement. I think clients are more digitally native and more, used to engaging digitally. And I think the providers are better. In version 1 of disease management, you didn't have any good, the providers who generally were delivering disease management weren't great. Now we have the best physicians and nurses and providers of all stripes who are engaging in digital and in leading innovation in the area.
So we have another question from the audience, and I think I want to start with Fran on this one, but again, would love to give everyone's thoughts in the few minutes we have remaining. And the question is that a lot of new digital platforms don't seem to directly involve the primary care provider or patient's direct care team. And the question is, why do you think that is, and is that really an ideal way to deliver this type of care?
Well, I do think it is an ideal way. I mean, the physician or the primary care provider certainly has the ability to find out what programs their patients are on, to connect with that, to direct them to programs. And it's just, I agree with what Connie said. The physicians, certainly the endocrinologists themselves, are much more involved in these programs than they were at the beginning. They're getting more and more involved. They're getting data. I mean, we need data to come into the, electronic medical record would be very helpful. But they are clearly aware that the use of their allied health providers, such as, dietitians, nutritionists, exercise physiologists, that those are being done digitally very successfully, and really integrating those and telling patients more and more about the programs that are available. And I think we're going to see a transformation. I think we're just at the upswing of that now.
Yeah, I would say I'm seeing some of the more progressive health systems add these digital solutions into their array of what they're offering. And I think it's to the questioner's point of view or perspective is what I think I'm inferring from it, is like there should be a connection between the digital and the virtual and the remote, with actual someone who is engaging with the patient on a regular basis that understands the entire, the patient's whole self.
And Connie, I'm interested in your perspective, since a lot of times with mental health, someone's primary care physician isn't always involved, even in traditional care. So.
Yeah, I think that's been a huge issue, just the siloing of the two when they're so interconnected. It's a hard problem to solve. And I think at Lyra, this is not the most tech-forward thing, but we've realized that there's just no substitute for getting on the phone and calling the PCP, calling the corresponding psychiatrist or therapist, and talking through the care plan. And we pay and pre-buy time for our clinicians to do that because we think it's super important. And then we e-fax the last clinical note. I'd love to say we had some magical API that automatically shared everything with everyone, but we don't. So, and I think it allows us to individualize care in a really powerful way.
So, all right. Well, we have about 1 minute left in this panel. So I'm just curious, looking for a short answer here. We are looking for beyond telemedicine. So I'm curious to know, what technology do you see down the pipeline that's coming, that's not here yet, that you're excited about? And I'm going to start with Sally on this one.
So it's a solution that I don't know exists yet. So it's a solution that I want to find.
Yeah. Or something you see coming, but maybe, hasn't gone through FDA, any kind of future tech that you want to kind of see.
Well, I think that I mean, coming back to what we were just talking about, and what Connie was talking about, and that is it's that interoperability between all of these technologies, and truly that is going to be the transformational opportunity that is going to come down the pike. I keep believing.
So, all right, Connie, what about you? What technology do you see coming that you're excited about?
This is it's a little bit more narrow for mental health specifically, and I think it is never going to be a very broad use case, but a lot of mental health care is about exposure specifically, and I think VR will be a really interesting therapeutic in that regard. Again, I don't think it's going to treat all of mental health, but excited to see the evidence build for the usage of that.
All right, and Fran, what technology excites you?
Well, I think from a diabetes standpoint, obviously something that can really integrate lifestyle in a much more significant way in with the overall therapeutics that we're doing, so that it's really integrated. And then, of course, I'm going to go back and give it to me all so that I have a record of it in my electronic medical record.
All right. Well, I want to thank all of you so much for being a part of this panel. We are unfortunately out of time. I think we could keep going all day if we could. But thanks to all of you, very much appreciated. Thanks to all of you in the audience who are out there listening, and thanks to Virta Health for throwing this conference. I think it's been really informative.
Thank you. Bye.